Very warm welcome to all the PhysioTV classroom viewers once again. And our today's session is on ergonomic risk assessment and work hardening. I am Dr. Suroshree Mitra, Professor and HOD in the Community Physiotherapy Department of Sancheti Institute of Orthopaedics and Rehabilitation, College of Physiotherapy, Pune. So, like in every other class, before we begin the session, we would like to share the objectives of the session. So at the end of this session, the class should be able to understand what is ergonomics, understand what is ergonomic risk assessment, identify the risk factors, and understand what is work hardening and its benefits. So always, whenever we have to start anything about workers' capacity, job demand analysis, or post injury return to work, or physical capacity, or our task or our job as physiotherapist for return to work or work conditioning, work hardening. So we always have to start with the basics of ergonomics. So as the International Ergonomics Association has defined that ergonomics is the scientific discipline concerned with the understanding of interactions among humans and other elements of a system. So it is basically the interaction of the worker with the elements which are around the worker. It could be work site, it could be anything else, it could be any interaction with built structures or any other humans at the workplace. And the profession that also applies theory, principles, data, and methods to design or in order to optimize human well-being and overall system performance. So it is not just about the analysis of it, but also about redesigning or designing as per certain principles so that the well-being of the worker is optimized along with the productivity of the worker. So basically, it is about the overall system performance. So ergonomics is a science-based discipline. So it brings together knowledge from anatomy and physiology. So when we talk of the alignment of the body, when we speak of mechanics, when we speak of functioning, so all we are doing is we are basically bringing together knowledge of anatomy and physiology, of course, psychology, because when we speak of interaction between two workers, two humans, or interaction of the worker with the VDU, with the visual display unit, interaction of worker with the machine, the man and the machine, the interaction of worker with his or her bosses, subordinates, peers. So a psychology also plays a very, very major role in that. We also in ergonomics incorporate engineering, because engineering is all about how well the engineering component or mechanization is supporting in productivity of the worker, as well as also reduction in injury of the worker. And of course, statistics, because nothing can be complete without data. So ergonomics is also about bringing together the field of statistics along with anat, physio, psycho, and engineering. So statistics is something which also assists as an outcome measure. So something as simple as in the last class when I said that we also in our history have to look into the absenteeism, the leaves taken by the worker due to any work-related issue or injuries. So same way, the statistics will help us reassess and come to a conclusion that if our therapy, if our management strategy, if our modification, job modification has actually helped in reduction of these complaints of the worker and ensures that the design complements the strengths and abilities of people who use it. So here we mean people, by people we mean the workers. So ergonomics has to align these different various fields together, and at the same time has to take care that designing complements the strengths and the abilities of the people, of the workers who are using it. So why exactly is ergonomics so important in the workplace? Because we all know as musculoskeletal specialists, or rather I would say as physiotherapists, musculoskeletal system is the first system we always have to look or assess for. So musculoskeletal system always may get affected due to these faulty postures. So therefore, knowing about ergonomics at the workplace plays a very, very important role. And as physiotherapists, we also should be able to sense the fatigue, the discomfort, the pain, which can be the first signs of a musculoskeletal disorder. So not to forget, if these workers tend to ignore these first signs at the workplace. So we are the ones who should be able to educate them so that they sense these first signs, so that these complaints do not get converted into any major disorder. And then finally, it can land up in very extensive therapy. So that is why ergonomics at the workplace is so important, and not just the bosses, but at each and every hierarchy, this education has to be imparted to the workers. Ergonomics also helps in creating a safe, comfortable, and productive workspaces by bringing human abilities and limitations into the design of a workspace. So every time knowing about abilities, of course, that is something very, very important. But knowing about limitations is also equally important. So, for example, the non-modifiable factors like height of a person, or a build of a person, or age of a person. So if that by any chance is one of the limitations towards productivity and can cause a risk of injury, so even that has to be taken care. And that is why we also talk of universal design when it comes to ergonomics and workspaces. So it includes the individual's body size, strength, skills, speed, sensory abilities, and attitudes. So we always have to remember that it's not just about the physical assessment, it also has to take care of the psychological assessment. Therefore, mental attitudes towards work, towards peers, towards entire culture of at the workplace has to be assessed when we talk of ergonomics. Now, what is an ergonomics risk assessment, abbreviated as ERA? So an ergonomic risk assessment is a program, process, or investigation implemented to identify, analyze, evaluate, and prioritize any risk from exposure to ergonomic risks associated with the workplace. So so that's why it's called a program. It's a process which is not going to be done in a day or two. So there has to be a proper planning done. There has to be a defined team who's going to do this. There has to be a defined set point or parameters which needs to be assessed. And as discussed before, these parameters have to be biological, psychological, and social, all three aspects. And this process and an investigation is implemented to identify first, then analyze based on the data and evaluate, and finally prioritize any risk from exposure. So once we prioritize, we deal with these risk factors in a systematic way. So if something is at highest priority, we deal with that risk factor first, followed by the rest of them. And ERAs also determine the level of ergonomic risk present in a job, task, or workplace under evaluation. So obviously, first and foremost, before the worker, we also have to assess the work culture or the job demand analysis. So how exactly these tasks can pose any risk to the worker, and also the workplace. So as I said before, work, worker, and workplace, all three assessments has to be done in an ergonomic risk assessment. The goal of an ERA is to identify and quantify the risk factors that may lead to musculoskeletal disorders or injuries at the workplace. So every time I understand that we are focusing on the musculoskeletal system the most, because as I said before, we as physiotherapists are our main domain is that, but nevertheless, the other systems also, due to certain specific occupations, can get affected. So, for example, the cardiopulmonary system. So, a lot of times we also have to do certain lung function assessments, not just the musculoskeletal aches and pain assessment, but for that, we will also maybe requiring additional assistance from a team member who is well versed with the rest of the analysis, and also how exactly this diagnosis can be made. So a lot of time, if an occupation has association of any occupational lung disorder with it, a pulmonologist can also be part of the team. So how do we categorize these risks? There will be physical risk factors like working in awkward postures, bending repeatedly, compression or contact stresses, forceful exertions, insufficient rest breaks, lifting heavy items, pushing, pulling heavy loads, reaching overhead, repetitive motion, static or sustained postures, and always vibrations has to be also considered. So as always discussed, that these will not be risk factors only for, like, if it is in if such postures or exertions or contact stresses are part of your job in an infrequent manner. Only when these postures are frequently used and they are regularly, repeatedly present in your tasks which you are doing and in your respective jobs, only then they become risk factors. So that is something we have to always keep in mind, that it is not just the presence of these. So it's not like if somebody is doing pushing and pulling activity in his or her job, say once a month or very, very occasionally. So that may not be the risk factor. But at the same time, if it is done on a daily basis, that will eventually become a risk factor if not done in a proper posture and alignment. Now, as physical risk factors, we also have the cognitive risk factors. So the cognitive risk factors are when the task is too complex or it's unfamiliar. So when a task becomes unfamiliar, when a training is not being given. So a proper training is very, very important so that the task which is given, which is challenging cognitively in understanding, so it becomes familiar first. So if it is complex and unfamiliar, automatically over a period of time, it will become risk factor. Sustained attention tasks. So when a person has to sit in front of the monitor for long hours and sustained hours, and it requires a lot of attention. So a lot of time data analysts and say accountants, a lot of time those who are working with softwares and have to really pay a lot of attention for sustained duration, even that can become eventually a cognitive risk factor. When the job is very, very monotonous, repetitive tasks are there, so a lot of times then that can become risk factor. And excessive memory demands. So when you have to remember, at the same time you have to act and you have to perform the task, if it is done routinely or frequently, that can also be a cognitive risk factor. And divided attention tasks. So when a lot of time you have to do multitasking, that can eventually, if it is done frequently, can also be a risk factor. Now, what are some tool-related risk factors? So when an occupation is such that it requires the use of any tool, so whenever there is any poorly designed tools, when the design is not as per the anthropometry of the person, so the modification or the universal design principles are not taken into consideration, tools are not fit for the purpose. So maybe the task is something, but the tool dimensions are such that it is not being able to apply a good amount of force. So sometimes that can also become a risk factor. Lack of personal protective equipment or poorly designed or maintained personal protective equipment. So the maintenance of the PPEs is also must when it comes to analysis of risk factors, and a poor design of the visual displays. Visual displays is nothing but the monitors which we use at workplace. So lastly, same way we have some environmental related risk factors present. That is noise, temperature, too hot or too cold environment, working in extreme temperatures, poor ventilation, poor or substandard lighting, chemical or dust exposure over a prolonged period of time on a daily basis, poor layout or housekeeping, that is not taking care of basic hygiene, uneven service surfaces present. So if you have to travel a lot of times from one point to another and the surfaces are uneven, that can also pose to be a hazard or environmental risk factor. Poor communication in between, say, the different hierarchical levels, and lack of participation in decisions. A lot of times that also is part of environmental risk factor, because if your opinions or suggestions are not taken into consideration or are not even heard most of the times, even that can pose to be a risk factor eventually. So how does APTA define work hardening? So coming to work hardening is defined as a highly structured, goal-oriented, individualized intervention program. So it has to be structured on a daily basis, on a weekly basis. You have to set parameters of progress. You have to set a reassessment timeline. It has to be goal-oriented. So obviously here, when we speak of goal-oriented, it has to do with goals related to your work and not just general goals. So work hardening has to take care of all the subtasks which are part of the job. Individualized intervention program. So suppose no two carpenters will have the same work hardening program. No two nurses will have the same work hardening program post injury or as part of return to work. So always it has to be an individualized intervention program, because although the work site and the job demand could be similar, but the worker's parameters, the person's strength, flexibility, endurance may not be similar or comparable. So therefore, it has to be an individualized intervention program designed to return the patient or client to work. These are designed to restore physical, behavioral, and vocational functions. So all we have to keep in mind that physical, that is biological, behavioral, psychological, and social and vocational functions. So all of it has to be taken care of. So it has to be a holistic program. Remember, in conditioning, mainly the physical parameters are stressed on, but in work hardening, all the parameters, including the person's body, the person's psychology, the person's behavior with the environment modification needed, and that can be built environment, that can be people around, peers. So all of that has to be taken care of in work hardening program. Work hardening addresses the issues of productivity, safety, physical tolerances, and workers' behaviors, all of it. So when do we start work hardening in a worker? When the work conditioning client has received acute rehabilitation services and is expected to return to his previous employment, such a program is established as the client is expected to become independent with safe performance of program activities. So remember, we do not want any re-injury to happen. We want the worker to get back to his daily routine with confidence that he will not have a re-injury, but at the same time we want him to be as productive as before. So these are the time points when you want to start work hardening. So these are some common differences between work conditioning and work hardening, as you can see on the screen. So these are the common differences between the work conditioning and the work hardening. So work conditioning addresses the physical and functional needs primarily, and it may be provided by any one discipline. So it can be one discipline at a time. So maybe when the physical therapist is working on the worker, the other team members may not be that actively working. So same way, when their goals are done, the person will probably then go to the next set of rehabilitation program. So same weight in work hardening, it basically takes care of all the domains, that is physical, functional, behavioral, vocational, within a multidisciplinary model. So the model over here is a multidisciplinary model as compared to the work conditioning program. Work conditioning will require examination, evaluation, and so is it going to be a requirement in work hardening as well. So this is a similarity. Work conditioning utilizes physical conditioning and functional activities related to work. And work hardening, it is the real work activities which the person has to go through in the rehabilitation program. So the dimensions of the physical things, for example, if someone has a container to pick up and keep it, so the dimensions of that container has to be exactly same. The weight of that container has to be exactly same as it is there in the workplace when it comes to work hardening. Whereas in work conditioning, a simulation, like say if the container is of 5 kg, so just a 5 kg dumbbell can be given and the person can be asked to lift and take it from one point to another. So that's the basic difference between conditioning and hardening. So conditioning is provided in a multi-hour session that is usually 4 hours per day to 5 days a week for 8 weeks. But in work hardening, the hours has to be increased because, as I said before, it is actually the real time frame for which the person has to be working at his or her workplace. So therefore, in work hardening, the actual number of hours has to be taken care of. So what does the program consist of? Essentially, a work hardening program consists of 1/3 of cardiovascular training tasks to increase endurance of the worker, 1/3 injury specific tasks, and 1/3
in progress.
1/3 direct tasks, that is in a real setup specifically focused on the essential and critical demands of the job. So as discussed before, the cardiovascular training plays a very, very, very important role when it comes to work conditioning, work hardening. So hardening followed by conditioning. So therefore, cardiovascular training has to be taken care in 1/3 of the program, and 1/3 has to be to the specific tasks which were major complaints of the patient, of the worker, that is during the work hours, the ones which were actually the aggravating factors. So that has to be taken care of. And 1/3, the directed towards activities in a real setup. That is all the work demands, essential work demands, which the person has to do for more number of hours, and the critical demands has to be taken care of. So that's how a work hardening program is designed. So in a work hardening program, physical conditioning is an aspect which has to be taken care of, and simulation of specific or general work requirements. So obviously the requirements of the work, the tasks which were aggravating factor, that has to be taken care of, and also the essential elements of the tasks both have to be taken care of. Training and modification of ADLs, activities of daily living, has to be given to the person. So it's not just about the workplace or task demands. It is also about any other ADLs or activities of daily living, which were also the aggravating factor for the same pain which the patient or worker would get at the workplace. Injury prevention and wellness education has to be an integral part of work hardening. So it's not just about the actions, it is also about timely counseling of the worker, so that there is no second injury or no other episodes of injury as severe as this one should happen. And wellness education, so to keep the worker positive all the time, because a lot of times during the program also the worker may get demotivated or may get quite negative regarding the condition which he or she is going through. So a lot of time wellness education and prevention education has to be given time to time. Cognitive behavioral pain management training. Now that is something very, very important. That is why a psychologist is also part of this program. So cognitive behavioral pain management also, so that the association of the worker with that particular episode of sometimes as simple as pain or sometimes as complex as an accident at the workplace. So to gradually take the person out from that association of that negative episode at the workplace, cognitive behavioral pain management also has to be part of work hardening program. And education has to be designed to return the client to his or her previous employment or the productive workforce. So the aim has to be that the worker has to become as productive as before the injury or an episode which had happened, and also improve his or her level of functioning. So interdisciplinary evaluation is done by a team consisting of the program director and a group of designated staff members. So as in any team, there has to be a leader who will lead this hardening program. He or she is a program director. It can be a physical therapist. It can be any other rehabilitation therapist who's also part of the team, and a group of designated staff members who are familiar with industrial rehabilitation. So not just the worker who goes through the training, it is also the rehabilitation specialists who are part of this work hardening program. They have to also go for time to time training for this industrial rehabilitation. Of course, in that team, client is an integral part, because the goal setting has to be always done with the client. A treating physician always has to be part of the team, because if there is a diagnosis made for the injury, the physician also has to time take care of the medication changes which needs to be done, and any sort of investigations which needs to be done as part of reassessment. A psychologist for ensuring that the psychological association of or then any negativity, demotivation related to the episode is gradually detached from the patient. Vocational counselor, so who will time to time also give counseling on if any sort of modification or change in job profile or job rotation or little slight modification in the job profile is needed to be done. So for that, a vocational counselor also has to be there. physical and occupational therapists, obviously, and any technical personnel who can be assisting during the rehabilitation program. So the benefits of a work hardening program is always there, is shown in the literature. There is increased return to work rates. There is an accelerated recovery. So a person going for a work hardening versus not going for work hardening, it has been seen that the person who's going for work hardening will mostly have an accelerated recovery and increased restored functions and productivity, and also reduced re-injuries are seen in these workers. And of course, the costs which are there, because a lot of time a rehab program can be a part of it. A part of this work hardening can be in groups also. So the company also has to incur lesser costs and invest less amount in the rehabilitation of the workers. And there is, of course, end of it is improved job satisfaction. So we'll just have a quick short example that suppose a courier driver was hit by a car while delivering a package. To get him in condition to go back to work, the therapists would offer him an education on how to build up strength. And this education has to be done not just once, but time to time, and perform exercises with him, simulate his work environment, a warehouse, a truck, delivery location. They would go over the steps of the job with him. Practice these tasks over and over again, working to increase the amount of time spent during the rehab period. So that was the main thing you saw, that conditioning is for half the duration almost as compared to actual workplace tasks. But hardening has to be ultimately for the total amount of hours a person is spending at the workplace. And the progression parameters and time frames have to be defined in a work hardening program. So with this, we end our today's session, and I'll see you next in the next Physio TV classroom session. Thank you, everyone.